right. Well, our numbers are still climbing a little, but they're starting to go steady. So I would like to go ahead and get started today. So welcome to our first in the series of the 2026 Horse Management Seminar. This is our virtual series. Tonight we will be talking about neurologic diseases. So I have a little bit of a welcome, some housekeeping tips, some things to talk about before I go ahead and introduce our first speaker. So first, I would like to say I am excited to be in a new role this year. If those of you have listened to our seminars in the past, you still hear from me as the Equine Extension Specialist at Rutgers University. Only now I am serving as the interim director of our Equine Science Center. So Dr. Karen Malinowski, who many of you probably remember, did retire this past summer. So I have taken on the role as interim director. So what that means is a lot of things. Well, we have a new location for our offices, but we also have a lot of new programs coming up. We're also going to maintain a lot of our older programs. So the good news is these seminars that we've been doing since 2021 after COVID have been so popular. I hear, and so popular, so much so that, yeah, we're at 275 of you logging on right now. I think that's fantastic. I love holding webinars so that they can be to very wide audiences. So thank you for attending, and I've got a little bit more information that I want to know about you in just a little bit. But what we're also doing at the center is we have a bunch of new hires coming to you. We're going to have some new equine faculty at Rutgers University. So stay tuned for more on them, and maybe next year at our webinar series, we're going to hear from them in terms of what they've been working on and what their interests are as well. So I do want to welcome our speakers. We've got some great ones today. I'm really excited about it. I'm going to be moderating the session, and we'll introduce the speakers specifically in just a little bit. I've got a few more things to cover, but one of the things is a little bit of housekeeping. So when you have a question, and it's going to be directed at the speaker on content, please go ahead to the bottom of your screen, and if you highlight or just hover your mouse over the bottom, you're going to see a bunch of buttons pop up. One of those buttons is going to be Q&A, so it'll say Q&A. Only use that if you're going to ask the speakers a question. So on content, myself and whatever speaker is not actually speaking at the time are either going to answer some of the questions along the way, or I'm going to flag them and save them for the end of that particular speaker's talk. And then we're going to start asking questions once they're all done. I'll moderate the questions. I know with this many people on, we're getting close to 300. We might have so many questions, I might not get to all of them, but definitely use that Q&A box. If you're having trouble with the Zoom system, if you have any questions about Zoom itself, maybe you're not hearing me, maybe some things look funny on your screen, please go ahead and use that chat box. So at the bottom of the screen, again, it's going to have this little chat instead of the Q&A. Only, again, Kyle Hartman, my man behind the curtain at the Equine Science Center logo, he's my special events manager, and he is going to be there to help you out with any questions you might have or any problems you're experiencing with the Zoom system. So just use that, not for asking questions of the speakers, but if you're having any technical problems. So with that being said, I do want to say from the bottom of my heart, thank you for coming. If you do enjoy these sessions, or that you enjoy anything that the Equine Science Center does, we'd love for you to give back. These sessions are free, but they do basically cost us a lot of time to run them. And we have a lot of other really great programs. If you're interested in giving back, please visit our website at esc.rutgers.edu. You can go there for all kinds of information, but also if you use /donate, $5, $10, $50, $5,000, we don't care what it is, it always goes to help. Whether it's research or education, we would love to have your help. So with that being said, thank you again. And what I would like to do, now that you know a little bit about us, I would love to learn a little bit about you. So I am going to share my screen here. You should be able to see a poll. So what I like to do is poll everybody, find out where you're listening from and what division of the horse industry you're involved in. So you can do this in one of a few ways. You can take your phone if you're watching on the computer and you can scan this QR code over on the left-hand side. Or if you'd rather do it through your computer, you'll be able to click on the link. And I believe Kyle has put the link in the chat. Yep, it does look like he has. You can click on that link and it'll take you to a window where you can start answering some questions for me. So make sure, and I see a couple abbreviations, don't abbreviate. I want to know what state you're listening from, whether it's Florida, I see Tennessee, Montana, Louisiana, Wisconsin. Thank you so much. If you don't abbreviate, every time someone says Pennsylvania or Maryland, the words are going to get bigger, okay? So that's why we need to make sure that everybody's answering the questions the same way. If you're not in this country and you're in another country, if you're not in the U.S. and you're in a different country, please give us your country. Because I know in the past we've had anywhere from 8 to 15 different countries participate on these webinars, and it's always fun to see where people are attending from. And I also love to see how many responses we have coming in. Right now it looks like we're up around 128 responses to these polls. Which is really, really exciting that we have so many people on tonight. I would love to think it's from all of the hard advertising we've done and all of our wonderful, wonderful speakers. So yes, New Jersey does seem to be the biggest one, which makes sense. That is where we are listening from in New Jersey. But we have all over the place, even some Rhode Island, Kentucky, New York, Texas, Washington. They are going all over the place. Let's see. We have Germany. Welcome, Germany. North Wales. Thank you. Who else? South Carolina, Tennessee, West Virginia, all kinds of things. 184 responses. So again, if you're just joining us and are wondering what's going on, well, we're just asking. I like to know a little bit more of the demographic and where everybody is from. So if you look in the chat, there is a link that you can click on, or you can take your phone and take a snapshot or click on this QR code, and it's going to take you to a couple of questions. And the first one is for you to enter your state or country and answer the question by not abbreviating, so we can see how many are from all different parts of this country and other countries as well. So that's starting to slow down. We have 200 people responding, so thank you again. I'm going to go to the next question, because now this is going to ask you, what is your primary interaction with horses? So if you're a horse owner, you can click that, but we'll give you up to 2. You could be a trainer, a barn manager. If you don't own a horse, but you just love horses, you can say enthusiast. Are you in a different area of the professional industry, whether it's a tack industry, feed, pharma, etc.? And this is equine industry. Our veterinarian, I know sometimes we have veterinarians on. Any equine assisted services, whether you're PATH certified or therapeutic riding, whatever, they fall into that category. Or other, there is a lot of other things. This time, I would love for you to let me know if you're an other, if you're this 8% of other, what are you? What part of the equine industry are you? And you could type this in chat if you want. You don't have to use the Q&A box here. This is just for me to see what our audience looks like tonight. So it looks like we do have a lot of horse owners. 36% of the respondents are horse owners. 16% of you are enthusiasts, 11% are trainers or you're giving lessons. We got 8% are barn managers. We do have 5% are some sort of equine industry professional. 2% veterinarians. We do have a lot of you in equine assisted services at 11%. And 8% other. Now let's go and see what this other is. We have horse rescues, breeders, a rescue sanctuary, awesome. We have a pony club, yay, pony club leadership, excellent, welcome. Sport horse groom, welcome, welcome. Lots of volunteers, college professor, a few college professors. Excellent. A vet student, welcome to the vet students. Excellent. USEF judge and a vet technician. All sorts of fun things. Thank you guys so much. I'm really excited. We have such a great turnout today. And I want to ask you to continue to send your responses in. Let's see if we've changed in terms of the locations here. This is exciting. Yep, New Jersey is biggest with Pennsylvania, Maryland right behind us. We even have some Germany, a couple from Germany, as well as at North Wales. So welcome everybody. All right. Well, I'm going to stop sharing my screen and we're going to get down to business here because I'm really excited to hear what our speakers have for you today. So while I go ahead and give her introduction, I would ask Dr. Sarah Colmer to start pulling up her slides and sharing her screen. So Dr. Sarah Colmer is a graduate of Penn Vet. She also received a board certification in large animal internal medicine from Penn Vet's New Bolton Center in 2022. She is now working on her second board certification in neurology. She thoroughly enjoys taking care of horses and helping people that are attached to them, teaching veterinary students and conducting research centered around equine neurologic diseases. So welcome, Dr. Colmer. Thank you so much for sharing your time with us tonight. So I'm going to go ahead. I'm going to stop talking. I'm going to stop sharing my face view, and I'm going to let you take over.
Great. Thank you, Dr. Williams, and welcome everybody. Thank you so much for joining us tonight. Hopefully you can hear me okay and see my screen. Let me know and let the crew know if there are any issues with technology. But my goal tonight is to talk to you about neurologic diseases in horses. So of course we don't have time to cover everything, but I hope to cover some highlights for you. And hopefully by the end, you'll have a little bit more information or a little bit more interest or curiosity about equine neurologic disease. But before we get into that, I briefly wanted to introduce myself. I am from New Jersey, so I'm very excited to be doing this through Rutgers. And my husband actually works for Rutgers Law School, so it feels like we're really keeping it in the family here. I am from Belmar, New Jersey originally, so over by the beach. It was a fun place to grow up, and New Jersey has so many horses, which inspired me forever. So this is a photo from my earlier years with my late mare. But currently, I spend most of my time with horses here at New Bolton Center. So New Bolton Center is located in southeastern Pennsylvania. For those who don't know, it's a wonderful place to work and a great place to be a horse person. But I do spend 25% of my job in Philadelphia, actually. So I am currently working towards a second board certification in neurology. And most of my time is spent with horses doing spinal taps like this, but sometimes I also do spinal taps like this on little dogs. But we are not talking about dogs today. So we're going to shift the focus to the horse. And to give you a little bit of an overview, I'm hoping to kind of share some of the reasons for pursuing a neurologic evaluation. And I think some of those are intuitive, but some of those may not be. I will also highlight how a neurologic evaluation is performed, and then go over some common neurologic diseases, especially some of the most common ones listed here in our case population, which isn't going to be the same all over the country and the world. But I think that for many of us, they will ring some bells, and hopefully we'll learn a little bit of something today. So why pursue a neurologic evaluation? Sometimes there are issues with the way a horse is moving. This horse has some subtle abnormalities. He's a little bit floaty, and sometimes we joke that it's a fine line between fancy and neurologic in the horse industry. And so some horses might have some subtle abnormalities in the way they move, while others may have much more severe abnormalities. You can probably see in the second video that this horse is struggling to just turn in the barn aisle without looking like he might fall over and potentially hurt himself or even those handling him. That said, there are reasons outside of the way horses move that can be neurologic problems. The horse on the left is one of our teaching horses at New Bolton Center, Zesty. We love her very much, but she has a permanent head tilt, which actually stems from a neurologic problem. The gelding in the middle panel, if you look closely, he has some spontaneous eye movements. You can kind of see his head and his eyes moving around, which is actually an abnormality in something called a cranial nerve, which we'll talk a little bit more about. And then in the third panel, yet another manifestation of neurologic abnormality. You can see this poor gelding has really, really abnormal tongue tone that's preventing him from being able to chew and swallow his feedstuffs. Still, other abnormalities that might have neurologic basis include horses not even being able to rise at all. This poor filly in the image on the left ultimately was diagnosed with West Nile virus. She couldn't get up on her own. Meanwhile, the gelding on the right panel also had a neurologic abnormality. He had something called a metabolic encephalopathy, so an abnormal value in his blood that was essentially causing some poisonous effects to his brain, and the part of the brain specifically that controls his kind of alertness and excitability and even his sight. So he was actually blind and blindly climbing and rearing into the wall. So you can see why we left his lead rope on. So to kind of give a brief overview of why a neurologic evaluation might be performed, sometimes we see things called cranial nerve abnormalities. These are problems with the nerves that come from the brain and kind of innervate the face and head. And sometimes those might look like blindness, for example, or something called dysphagia, in other words, trouble swallowing, and also facial asymmetry. I know some of us have probably encountered EPM in our horses or horses that we know that might present with abnormalities in the way that their ears, their eyes, or their muzzle look from one side of their face to the next. Other abnormalities include something called mentation changes. These are changes in the horse's kind of alertness and awareness of his surroundings. They can range from really hyper-excitable, like that horse I showed you climbing the walls, to horses that are very dull. Seizures are yet another neurologic abnormality that would cause you to want to pursue a neurologic evaluation. A history of trauma to either the brain or spinal cord is yet another. And then, as I alluded to, abnormalities in the way horses go, or ataxia, which is really just a fancy word for incoordination. Recumbency is a fancy word for inability to rise. Behavior changes, even subtle ones, can sometimes have a neurologic basis. And we can even see muscle abnormalities in horses be the result of a neuromuscular problem. Things like weakness and trembling can also be attributable to conditions like botulism, for example. And then even more subtle things like poor performance. And of course, pre-purchase exams are a good opportunity to make sure that the horse you're about to purchase is neurologically sound. So how do we go about this process? We do it in a very stepwise fashion. So I'm going to kind of overview what we do at New Bolton Center, which might differ from what your vet does. And every vet has their way of doing these things, and no way is better than the next. But the way that we typically approach this is by starting with mentation. Mentation, again, is an assessment of the horse's kind of awareness of his surroundings and how bright and kind of awake he is. Is he normally acting, or is he quiet and dull, or is he climbing the walls? The horse in the panel on the left has his ears forward. He's paying attention to the person taking the photo. He looks very bright and aware. The horse on the right, however, has a bit of a dull expression. His eyes are partially closed, his tongue is hanging out of his mouth, and his head is kind of hanging low. So even without watching a video of these horses, you can get a sense for their kind of awareness of their surroundings just by looking at photos. And so usually when we start our evaluations of these horses, we begin by just looking at them outside of the stall. So are they bright and aware, or do they look dull and, a fancy word, obtunded? So really just not interacting with their environment. After we've assessed their awareness of their surroundings, we will typically move on to the cranial nerve evaluation. So that's where we assess these 12 reflexes and responses of the head and face that can give us information about brain health, specifically a part of the brain called the brainstem, which houses the machinery essentially for all those reflexes. And so we'll do things like, I should have gloves on in that first photo, but we'll do things like pull the horse's tongue out of his mouth to make sure it's functioning properly. In the second panel, you'll see a flashlight being placed onto a horse's eyes to look at something called a pupillary light reflex or light response, which is basically assessing the response of the pupil to light. And pupils for horses, just like us, should become smaller when we shine light on them. And then when the light goes away, they should dilate again. But some horses with brain disease or other issues might not have that reflex. So that's one of the subtle things we can look for. The horse on the right panel, this is a photo, not a video. If you look really closely, you'll notice that one of his ears is drooping, the ear on the left. And you might also note a little bit more subtly that his muzzle is deviated to the right. That's an abnormality with the facial nerve, another one of those cranial nerves. So when we see these abnormalities, they can give us hints as to which part of the brain or nervous system is affected in these horses. And once we figure that out, that helps us decide what our top differentials, or in other words, what our top most likely diseases will be, and that will help us formulate our diagnostic plan. Once we've assessed their mentation and cranial nerves, we'll also look at the whole horse for posture and muscling. So in these images on the left and in the middle, this is a horse that has a long-standing history of incoordination and chronic muscle loss. And he just looks almost like a giraffe in that first picture. And I promise that picture is not altered at all. He just had very poor muscling across his caudal cervical or base of his neck region. He also had pretty poor muscling across his top line and his gluteals, which can be attributable sometimes to neuromuscular disease, as it was in this horse. In addition to his muscling, you'll notice in the middle image that he has a very abnormal stance. And so horses should often stand square when they're not doing other activities. And unlike us, like if you look down at yourself while you're just standing around, crossing your legs, off-weighting a leg, horses most often should square up when they are standing still and in between maneuvers or exercises. And so one of the more subtle things that we can see before we even start our gait evaluation is we can notice these horses in the stall or in the arena, kind of between maneuvers, standing very base wide or base narrow. The reason why that can be important is because it can give us a suggestion that the signals from the brain all the way down the spinal cord to the legs and back again might be interrupted, and that horse is essentially not aware that his limbs are not where they should be. And so although some horses are probably just a little bit more lackadaisical than others, we can put stock in this when it's something we see during our neurologic evaluation as a mild abnormality. And we kind of take it in the context of other abnormalities, as we see them throughout the evaluation. So although it's not a severe issue on its own, it's sort of like a mark on the report card, if you will, during our neurologic evaluation, if we notice a horse standing abnormally or exhibiting abnormal muscling. Now, before I get into the meat and potatoes of the evaluation, which is the gait, we use something called the modified Mayhew ataxia scale. And if your horse has had a neurologic evaluation, you may have heard your veterinarians use this terminology of a scale from 0 to 5. And I'm not going to go through all of it here, but essentially it's a scale that goes from 0 being perfect all the way to 5, where the horse can't even stand up stand up on his own and require slinging, for example. Many horses that we see fall in the kind of earlier side of this scale, grade 1s, grade 2s, but we certainly see horses reach grade 3, grade 4, and grade 5. And so this scale, although it's certainly subjective, it helps us kind of compare one horse to the next and also monitor their progression over time. So when we are watching horses do ambulation or walking, trotting, somehow ambulating in some way, we usually start with just walking in a straight line. When we watch them walk in a straight line, we're looking for obvious problems like tripping and falling, but we're also looking for more subtle things, toe dragging, toe scuffing, that kind of thing. And so watching this first video, you might notice that this horse, we're asking her to walk in a straight line, but she has a very unpredictable foot placement pattern. So horses that walk in a straight line, just like us, should walk in a very consistent, normal way. But this horse really struggles to keep a straight line. She sometimes crosses one leg over the next, and you just get the sense that she might stumble and fall. After we walk a horse in a straight line, we then trot them in a straight line. And I want to be clear that at New Bolton Center, we're lucky enough to have specialized services. And on the neurology service, we're not usually assessing horses for comprehensive lameness. But one of the reasons why we trot the horse in the beginning of our exam is to make sure that he or she doesn't have a significant lameness, because that's going to affect foot pattern. So that video I just showed you of the horse walking, she's walking unpredictably, but if she has a really severe lameness, and lameness is usually most visible at the trot, like in this guy who has a very severe right hind limb lameness, that's going to affect our ability to interpret the rest of the gait evaluation. So the reason why we incorporate the trot is primarily to make sure that we're not dealing with a really significant lameness that might almost make a horse falsely look neurologic. After we do our trotting evaluation, we'll have the horse walk with his head elevated. And what that does is it asks him to rely on his limbs and their relationship to the ground in space, and takes away his ability to visually compensate, or in other words, use his eyes to kind of help him navigate the ground. So what we do is we elevate the head, as you can see in this video, and we're watching his foot placement. See how he's very hesitant to place his feet. He doesn't really want to walk like that. It's very hard to predict where his feet are going to fall. And he wasn't doing that until we lifted his head. So essentially, we're asking him to use his awareness of his limbs in space. And if those are affected by disease, he's not going to perform very well on that task. After we do head elevation, we will pull the tail to give us a crude sense of hind end strength. So essentially what you're going to see here is our technician walking the pony away, and then one of our residents pulling the tail periodically as the horse is walking away, and then again towards us from the other side to get a sense of how easy it is to pull her off the straight line. That will help us understand her strength. And we're also wanting to make sure that she's not stumbling or knocking her hocks together or any other abnormalities as she regains her center line. After this, we will typically walk these horses in tight circles. And what we're looking for as we walk in tight circles is for them to normally, and this is a little bit confusing, and when I do this lecture in person, I have an interpretive dance, so I can't do that over the camera tonight. But what horses should do is cross over their hind limbs and their forelimbs as they circle. That's a normal thing they should do in order to navigate the circle. But what they shouldn't do, and what you'll see in this image on the right, is this horse swings his outside hind limb in the circle very excessively. So even if you're not staring at horses all day, every day like I am and the way that they move, you might believe me when I point out that he often has a very exaggerated way of placing his right hind limb. This was a horse who was ultimately diagnosed as a wobbler. And again, this is a manifestation of sort of an interruption of those signals from the brain through the spinal cord to the legs and back again. This is a slow motion video that I really like from my mentor, Dr. Johnson, that shows what horses should do with regard to crossing their legs in tight circles. What they shouldn't do is pivot. This horse is crossing over his limbs. So see how that inside hind comes across the outside, and then the outside fore is about to come across the inside. And so this is a nice slow-mo of how horses should navigate tight circles. Once we've done tight circles, we'll ask the horse to walk up and down a hill, first with his head and neck in a natural position, and then with his head and neck elevated. And of course, not every farm is going to have a hill at their disposal. We're lucky to have it. But what we're looking for is any abnormalities in foot placement. And see how those front legs are very hesitant to be placed on the ground. He becomes very slow. And then at the bottom of the hill, he has this kind of long, exaggerated stride. And if you could hear the audio, he also buckles in his hind limbs at the beginning when he's coming down the hill. So all little subtle abnormalities that make us concerned when we see these add up. Something that we don't always think about that I think is a little bit easy to miss is, in addition to their legs, look at the rest of the horse. So what you may not notice initially, but perhaps after I point it out, it'll become evident, is that as our technician is asking this horse to walk in tight circles, if you stare at his legs too long, you won't notice he's very stiff in his head and neck. He's almost like a 2x4 or a weather vane in the way that he's moving, instead of turning his head and neck with the person leading him, and he's pinning his ears. So horses' facial expressions can also give us really valuable information, and we have to train our eyes not to only be looking at the legs, but to look at the rest of the body for signals. And this horse had really severe neck disease that was extremely painful and caused him to have some subtle abnormalities in his gait. But more than anything, he was so stiff and unhappy, which is arguably even more relevant. So it's a good reminder to us and all, I think, to kind of look at the whole horse and don't get too distracted by the legs all the time. Another important note about the neck, at the end of our neuro evaluations, we started adding in a step where we watch the horse graze. And I always have to explain to owners that although we do love just standing there and watching their beautiful horses graze in the grass, the function of this is to make sure that the horse is comfortable enough in his neck that he adopts a normal grazing posture. So I think we can all look at this video and agree that this mare does not seem to have a very normal posture, does she? She has to split her legs almost like a giant foal to reach the grass, and she has to adopt a very narrow pattern of placing in her hind limbs when she goes down to reach grass. This mare also had very severe neck disease and was very uncomfortable through her neck, and it most obviously manifested in the way that she grazed. So not something you always think of as part of your evaluation, but something that can definitely be illustrative in some cases. So I'm not going to read this to you. It's essentially just an overview of everything that I just went through in the order that we do it for our evaluation. And the reason that we do it in this order is to make sure we don't miss anything, for one, but we also want to go in an order so that we essentially go from easier to harder maneuvers for the horse. And so that's kind of a safety mechanism for us. If things get too hard for the horse, we stop, and also can just be a way of gradually increasing what you're asking of the horse and then seeing what he does. At the end of our exam, we ask ourselves, is the horse normal or abnormal neurologically? How many legs are abnormal? What type of incoordination are we seeing? And this is outside the scope of this discussion, but for the vet students in the room, they'll know what I mean when we talk about trying to understand if the abnormalities we're seeing are coming from something called upper or lower motor neurons, which can help us decide where in the spinal cord we're seeing the problem. And then I showed you guys the grading scale. We'll grade these horses. Sometimes the grade in the forelimbs and the hind limbs might be two different grades. Often horses are more affected in their hind limbs. They kind of have a longer route to travel, those nerves and those neuronal connections. And then the fancy word neurolocalization, in other words, essentially is taking all the information from our gait evaluation, from our cranial nerves, and from our mentation, and deciding where in the nervous system the problem lies. Once we do that, we can figure out what kind of problems we might have that are causing these issues, and then make a diagnostic plan. So this is an example of a horse who presented to us a few summers ago. He has some mild incoordination. If you watch this circling, you'll see he has kind of excessive swinging of the outside hind limb. He drags his inside hind limb. He's almost creating a little crop circle there. And this middle-aged warm blood gelding had a history of just progressive poor performance and really random explosive behavior issues, which we're going to talk about in a couple slides. And this represents most of the cases that we see on our elective neuro service. So these are cases that are either being referred in or are owners coming directly to us wanting neurologic evaluations for horses with poor performance and or incoordination. And when we see this pattern of abnormalities in all four legs like this, we call it a cervical myelopathy, which essentially means a problem that's most likely located in the spinal cord in the neck or elsewhere. And our top three most common sources of this abnormality are EPM, equine protozoal myeloencephalitis, CVSM or Wobbler's disease, and a third category that I think is a little less common for some of us, but neurodegenerative disease called EDM or ENAD. So we'll talk about each of those three. Starting with EPM, equine protozoal myeloencephalitis, I can barely say it right now, is a protozoal disease. These are single-celled organisms, and there are so many of them, but the two that we know cause EPM are Sarcocystis neurona and Neospora hugesi. And we are fortunate enough or unfortunate enough to have EPM in the Americas, essentially, but we actually do not have EPM in Europe, so they are a little bit luckier than us. So some of our German friends joining this evening don't have to worry about this in their horses, but they do if they were imported from the US. It's a really interesting life cycle that the vet students in the room have to learn for their board exams, but to kind of make it a little bit more accessible, essentially there's something called a definitive host. And definitive means that it's the animal that sheds the organism in the feces. And I think many of us know that that is our friend, the possum. Intermediate hosts are these woodland creatures here on the left side of the image, things like skunks, raccoons, and depending on where you are in the US, the armadillo, that house the parasite for some part of his life cycle so that the parasite can grow and eventually be consumed by the possum who deposits it on the ground. The dead end host, it's called dead end because horses don't shed this organism to other horses. So I think that's a really important takeaway, is that this is not a disease that's going to go from horse to horse on the farm. The parasite can reach the horse, but he's not going to end up making more of himself in the horse. And many horses come into contact with this parasite, but very few actually end up getting neurologic disease. So that's going to be a takeaway. In the literature, with regard to which horses get EPM, essentially anyone can. It seems like there's something called a bimodal distribution where it's often in younger horses and in older horses, and that might be because of their immune systems, essentially. So when we think about young horses, they may not have as developed of immune systems, and older horses might have weaker immune systems. And the more popular breeds are where we see it, but that's probably because that's what makes up most of our, horses in our population. There doesn't seem to be a sex bias, so not a preference for gelding versus stallion versus mare. And as I mentioned, it's often just one horse on a farm. However, there are some cases where it's considered endemic, or in other words, some farms seem to have a lot more disease than others. How do we diagnose EPM? We start with a neuro exam. So we talked all about neurologic exams and what we do to amass that information during our evaluation. And if we have neurologic concerns, we want to rule out other diseases that might look like EPM. So if you have a horse that's incoordinated, for example, your vet might also take x-rays of the neck, which isn't going to diagnose EPM, right? But it might rule out other things like wobblers, which we're going to talk about. And then lastly, we want to prove that the horse is exposed, or even better, that he has active disease, which will hopefully make sense in a couple slides. So in vet school, we learned that EPM is the 3 A's: atrophy, or muscle loss. So see the image on the left, the horse's left gluteal muscles leave something to be desired. Asymmetry, meaning that the abnormalities, whether it's muscle loss or incoordination or facial nerve things, are asymmetric, meaning one side's more affected than the next. And number 3 is ataxia, or incoordination, which I know we've been talking about, can be a common presentation for EPM. Although we learn the 3 A's in vet school, the reality is that horses don't always come with the 3 A's. They don't like reading textbooks, it seems, and doing the things we expect them to do. And we say in the biz that EPM can do anything it wants. So it can look like all sorts of different things. Diagnostic testing is tough, but the ideal thing to do is to collect cerebrospinal fluid and blood. But of course, that's not always something feasible in the field setting. It might be cost prohibitive, for example, or it might not be safe for a variety of reasons. So there are many scenarios where treatment might just occur without CSF testing. One of the tricky things, though, is that blood tests alone can only tell us if the horse has been exposed to the organism. So what that means is that a positive blood test tells you that the horse has seen EPM before. He's eaten possum poop, essentially, is what it tells you. But it doesn't tell you if he actively has EPM. The only way to do that is to obtain a cerebrospinal fluid sample with the blood to look for antibody production in that fluid. Unfortunately, the most sure way to know we have EPM is post-mortem evaluation, but we don't typically want to start there. So as I noted, there are many scenarios and many reasons why one might start with might just rely on treatment and the response to treatment and see if the horse gets better with treatment. Then that's great. Maybe you had EPM and you fixed it. However, of course, the risk with that is if you treat without testing first, you may be out a relatively significant amount of money after a month or 2 of treatment and not necessarily have been treating the right organism or the right disease. Treatment looks like the following generally. There are 3 FDA approved anti-protozoal drugs that are usually administered for at least a month. And generally, our protocol is that we reevaluate these horses neurologically after each month of treatment to decide if we want to continue with the medications. Anti-inflammatories are often given in conjunction with the medication, at least for the first few days. And then we like to put them on vitamin E as a neuroprotectant. Vitamin E is an antioxidant. It's very helpful for neuromuscular and just any neurologic disease and insult. So we usually add that on to the treatment protocol. The next question is, what is the prognosis for these horses? And it can be really variable, but essentially, the more severely affected the horse is, generally, the worse the prognosis is, which is pretty intuitive, I think. But if your horse is down and can't get up on his own, he's going to have a much worse prognosis than the horse that's just mildly uncoordinated, right? So that's the kind of trend for most neurologic diseases and just diseases in general. But in the literature, it's stated that about 60% will improve at least 1 grade. So remembering that ataxia scale. About 20% will completely recover, but there are some horses that are thought to potentially relapse, which is an interesting concept. More mildly affected horses, again, the data is limited, but they have a considerably better outlook in our professional experience, and the majority of them will improve. But I do think it's important when you're thinking about whether or not you're going to treat for this disease to realize that not every horse is going to get better. So that is something to keep in mind. How do we prevent this disease? Keeping our feed room doors and feed containers sealed is really important. I always tell this story. I had a friend send me a picture of her feed tub in her feed room. It was a trash can like many of us use. She opened the lid to the trash can and a possum was literally sitting in the grain, eating it and presumably defecating in the rest of the grain. So she did throw that away. Feeders can be used to minimize wildlife access, especially in our older horses, making sure we clean up dropped grain. That can kind of encourage some of our possums and other friends to come take a snack. Implementing rodent control, again, because rodents may be a part of that kind of intermediate life cycle. And the easiest bullet of all of these, of course, ensure proper equine health and fitness, which I know we all strive to do every single day. I always get this question, so I threw this slide in. What about Lyme? True neurologic Lyme disease is very rare, even though exposure is so common based on blood tests. Again, with EPM, similarly, with Lyme, paired samples of cerebrospinal fluid and blood seem to be one of the more sensitive ways for us to convince ourselves that what we're dealing with is a true active neurologic Lyme disease. And lastly, for those that have experience with the Lyme blood test, there are these proteins that we measure the response to called outer surface proteins, and some horses just make antibodies forever and they never go away despite treatment. So it can make using blood tests really difficult to manage Lyme cases. But I just wanted to kind of toss that in because I know it's something that comes up a lot. We are going to shift now to signs of neck disease. So we talked about the infectious EPM and a little bit of Lyme category. And now we're going to shift to neck disease, which can also cause incoordination. And I already introduced you to this guy, who was our young standardbred colt that ended up being a wobbler or having spinal cord compression. The image or the video in the middle panel here shows another horse with abnormal grazing posture. So this one wasn't necessarily uncoordinated, but every time he grazed, he had to off-weight his left forelimb. And then this image, not very intuitive, but there are some horses with unblockable forelimb lameness that actually stem from neck disease. So these are kind of 3 very different presentations, all representative of different neck disease manifestations. When we're dealing with neck disease, one of the best ways that we can kind of start our investigation is to take x-rays. So this is a normal x-ray of the base of the neck. Horses, just like us, have 7 vertebrae in the neck. And so what we're looking at here is the 5th, 6th, and 7th vertebrae in the neck. So if you burn this image into your mind, see that these are the joints here where the bones are communicating, and then underneath each joint there's sort of like a black hole, and that represents the space where the nerves come off the spinal cord. The spinal cord lives in the canal, which is kind of carved out in the middle of these bones. Now what you'll see in this image compared to the last one is we no longer have that black kind of hole underneath the joint. And what that represents is bony proliferation, or in other words, the bone has just kind of gotten bigger and bigger to the point where it's impeding possibly that area where the spinal cord lives and the nerves that come off of the cord. Here's another example. So compared to the image on the previous slide, you can just see all this irregularly surfaced bone and absence of those black holes in the joint. So I'm going to back up to this slide one more time. Again, you can kind of see those holes in between each of the vertebrae. And then here we can see just a lot of abnormal bony surface and an absence of those areas where the nerves come out. So these are just different representations of abnormal x-rays of the base of the neck, which is something that we see relatively commonly in horses with incoordination. And the reason why is when we have those bones that get bigger and proliferate, they can actually impinge on the spinal cord and interrupt those signals that I keep talking about from the brain to the legs and back again, resulting in abnormal limb placement. Now, if you've had a horse that's a wobbler, you might be familiar with this. The difference between this image and what I showed you on the previous slides is that in the canal where the cord lives, there's almost like what I tell my students, this reverse Oreo. There's white, black, white. And the white represents a contrast or a dye that we actually injected around the spinal cord in order to look for spinal cord compression. And so in between these bones, I'm not sure if you can actually see my cursor or not, unfortunately. But in between these bones, you can hopefully see that at the top of the bright white line, there's almost like a little triangular area of darkness where we no longer can see that contrast. And what that is indicative of is attenuation, which is, again, a fancy word for just narrowing of the canal. And so if you think of that white line as space and fluid where the cord lives, you can imagine if we're losing that line, we're losing space. And so at each of these joints, this horse had spinal cord compression or wobbler's disease. Oh, I forgot I had arrows. So hopefully you can see those there. Something else that we have at our disposal in a hospital, and certainly not in a field setting, is CT or computed tomography. And the image on the left shows what we have at New Bolton Center, which is this kind of cool CT where we can actually get images of the horse standing so he doesn't have to be anesthetized. And what you might look at when you look at the image on the left versus the right, what you might see is in the middle of that image is the spinal cord, and the contrast is the white line around that dark oval of our spinal cord. On the right side, can you guys see how all of a sudden it's almost like blackout in the canal where all that contrast is gone on the right side of the spinal cord? And this was a really cool example of spinal cord compression from the side. So we're actually looking down the barrel of the canal here and seeing that we have spinal cord compression not only from top to bottom like the other slide, but we actually have spinal cord compression from the side of the cord that would only be caught on a CAT scan. So what do we do with these guys? Well, there are some medical options available, which we can talk about at some point, but for the sake of brevity in this presentation, one of the best ways to address spinal cord compression is actually something called surgical stabilization. And I know this is a ton of metal. So what we're looking at here is on x-rays, metal shows up really bright white. So hopefully you guys can see that right here, we have two different constructs, meaning kind of like two different sets of metal, if you will, where we have a plate, a bunch of screws, and something called a spacer, which is like a little torpedo-shaped piece of metal that goes in between the bones where the intervertebral disc lives. And we don't have time to go over the surgical procedure in total, but what I want you to know is that one of the surgical mainstays is to actually fuse the bones together where there's compression. And what that does is it kind of stops progression of the bony changes, the arthritis, the degeneration that's causing the enlargement of the bones. And actually over time, the bones, because they're fused together, will start to atrophy a bit and potentially open the cord up to have more space. It also stabilizes the bones together, and some horses are only compressed when they're flexed or extended. And so you can imagine then if you're fixing the bones together, you're not going to have that anymore. So surgery is one of the ways we can address wobblers. But sometimes we've done a spinal tap and the horse is negative for EPM. And then we do a myelogram and he's negative for wobblers. So what's left? The last category of disease we're going to go through is called neurodegenerative disease, or ENAD-EDM. It's such a mouthful, but it stands for neuroaxonal dystrophy and degenerative myeloencephalopathy, which are also million-dollar terms for essentially a chronic neurodegenerative disease. So degeneration of the brain and or spinal cord that happens symmetrically. So unlike our EPM friends who might be abnormal on one side of their body, typically our EDM horses are affected symmetrically on the left and right sides. And one of the crazy things about this disease is it can present with some really remarkable behavior change that we'll talk about. There is no way to diagnose EDM in the living horse. How frustrating that is for us, how frustrating that is for you. It's frustrating for everybody. The only way to diagnose this disease is at postmortem. And importantly, it's actually our number one most common postmortem neurologic diagnosis at New Bolton Center. So this is something that we diagnose all of the time. It's a really, really frustrating condition. And this is a piece of literature that was published in 2023 out of New Bolton Center that looked at 100 cases of our caseload specifically at NBC between 2017 and 2021. So 100 horses. And 73 of those horses had a history of incoordination. And 69 of these horses had a history of abnormal behavior. And so I've included kind of the breakdown. Many of those had behavior issues under saddle. The image or the video, on the right is a horse who would just randomly buck his rider off. And I don't want you to take away from this that every time a horse does something naughty, it's neurodegenerative disease, because that's certainly not the case. But in many of these cases where the diagnosis was made, these horses had a history of often unpredictable behavior issues. Like they would go around the ring 15 times, and on the 16th time, there's suddenly a purple gorilla in the corner of the arena, or they would just absolutely act like they were electrocuted with no apparent stimulus. And so these horses would have issues under saddle, but also on the ground. And they would even have sometimes history of aggressive behavior towards their people, towards other horses even. We had a horse or two that went after and ultimately resulted in the death of a paddock mate. So just really unpredictable, non-typical horse behaviors. And then the last thing noted is abnormal dropping of the penis, which I know sounds silly. And we've coined the term penis ataxia, but essentially there is an unusual percentage of the horses we go on to diagnose with EDM that present with variable degrees of penis extrusion from the sheath. Or in other words, their penis kind of hangs out of their sheath, not usually as intensely as these two. Usually it's just a couple inches, but it's something that we've again, anecdotally noted, so you won't find it in the literature yet, but we've actually started to find abnormalities in the spinal cord in the region that controls the penis that might explain this and be a part of this disease process. So where does this disease come from? Honestly, we are working on that. A lot of people, the greater we. It's thought that there might be a genetic predisposition. So many of these horses that are diagnosed have a history of family members, either parents or siblings or what have you, that also have neurologic issues. So there's no gene identified though. So we can't test like we can for PSSM1 in the quarter horses. We don't have a known gene, but rest assured that one of our collaborators, Dr. Carrie Finno, among many others, is tirelessly working to investigate for a potential gene that might be able to help us understand this disease and test for it. There are some interesting pieces of literature that suggest, based on surveys, which are limited, but suggest that there might be environmental exposures. There's one study that was a questionnaire that associated exposure to wood preservatives and pesticides and other things to increase likelihood of this disease. So if you pay attention to the human neurodegenerative literature, there's always stuff coming out about, for example, living across from a golf course being associated with Parkinson's disease. And I literally bought a house 2 years ago across from a golf course before I knew that. And one of the theories is that the pesticides and things used to control like weeds and things like that on golf courses might leach into the water source and cause issues to our nervous systems over time. So there's a lot of interesting research coming out about possible links between environment and neurodegenerative disease. And the thing that holds the most weight so far in the literature is vitamin E. So I mentioned nutrition as a possible etiology, and vitamin E is a neuroprotectant. We talked about it with regard to supporting our horses with EPM, for example. And vitamin E is something that we can measure in the blood. And in many horses with neurodegenerative disease, it's low. And we think that some horses might just have a higher metabolism, or in other words, kind of burn through it more than their paddock mates, for example, that don't have neurodegenerative disease. And so maybe they just have a higher need for vitamin E than the rest of their cohort. But one thing that we can do is test for low levels and supplement the horses that are deficient in an effort to hopefully stop the progression of the disease if that's what we're dealing with. But it's been a really interesting kind of field of research to see associations of low vitamin E with these horses. And as I alluded to, we cannot confirm it in the living horse. So even if the horse has low vitamin E, that does not tell us he has EDM. There are many horses with low vitamin E that are doing just fine, that might benefit from supplementation and not necessarily have neurodegenerative disease. But if we've ruled out our wobblers, we've ruled out EPM, we're dealing with what we think is EDM. We call it a working diagnosis. So if we ruled out the alternative things and ruled out pain and all sorts of other sources of the issues we're dealing with, we think we're dealing with EDM, which is, again, a frustrating place for us and for horse owners. But the only way to know for sure is postmortem evaluation. And so at postmortem, these horses have characteristic abnormalities in certain tracts of their spinal cord. So the areas of the spinal cord that control kind of like where their feet are placed, which is probably why we see abnormalities in foot placement, and also a part of their brain called the brainstem. Prognosis for these horses. So if we do reach that working diagnosis with a living horse where we suspect that what we're dealing with is EDM, is very variable. So some horses might just stay the way they are for the rest of their lives, and hopefully that's just mildly affected. But there are many horses who might progress in their ataxia or their behavior, and some might even necessitate euthanasia if they become a danger to themselves or those handling them. So these cases can be really, really tough. This is an example of a horse with some mild incoordination. We'll watch him go up and down the hill and see what he does here. So as we're watching him, pay attention to his front feet. See how he's kind of floating those feet. He doesn't really know where the ground is. And he's not falling over. A lot of these horses with EDM have grade 1 and 2 ataxia. So they have some incoordination going down a hill, or maybe they don't circle very well. But most of the time, these aren't the horses that are falling over necessarily. However, they can certainly get to that point, and or their behavior can make them a danger to themselves and others. So to summarize, there are many, many reasons to pursue a neurologic evaluation in the horse. We talked about just a few of them today, but there are many, many more still. And the neurologic evaluation generally has 4 main parts to it that we kind of went through earlier. But again, to refresh you, there's mentation, where we assess the horse's awareness of his surroundings. Our cranial nerve evaluation, where we test the reflexes and responses of the head and face to get some information about brain health. We also assess their posture. Remember, the way that they stand can be a subtle abnormality, but something worth noting. We pay attention to their muscling across their neck, across their top line, across their hind end. And I didn't get into this in this lecture, but reflexes are something we definitely do more in dogs and cats. So can you imagine a big reflex hammer hitting the kneecap of a horse? It's not going to go very well, but there are some ways that we can test reflexes of horses, namely if we take something that has a little point to it, like a pen, for example, and kind of poke along their neck and along their back, we can make sure that they have proper responses to that. But that's sort of outside the scope of this conversation. And then lastly, gait. And I think it's funny because when I spend time with the small animals, I am way more excited than anyone else to watch them walk and trot down the hallway. And then my coworkers remind me that no one is riding the corgi and no one's riding the French bulldog. So I probably don't need to worry too much about the way that the French bulldog is doing tight circles. So context is important, but certainly in our horses, gait is really, really important. And then the findings of our examination dictate what is again called our differential diagnoses, or in other words, what are the diseases? And I've outlined 3 of our most common diseases when we see horses that have incoordination. But when we finish our exam, are they normal or abnormal? In which part of the nervous system are they normal or abnormal? And then we go from there. Once we've made our list of possibilities, that's going to tell us what kind of steps are we going to take to try to figure out what's wrong with this horse. Are we going to do a spinal tap for EPM? Are we going to do x-rays for wobblers? Maybe a myelogram, a CAT scan, maybe even some other things that we haven't covered in this discussion. So with that, hopefully we learned a little bit of something tonight. I hope that that was interesting. I hope it sparked some intrigue, and I'm happy to take any questions you have. But these are just a couple photos from what I think is a really fun job, whether it's small animals or large animals. But with that, I'll take any questions.
Awesome. Thank you very much, Dr. Colmer. That was wonderful. I learned so much, even though this was the second time I saw it. I learn more and more every time. So there are a bunch of questions. I just want to remind everybody, if you do have a question for the speaker, please use the Q&A box. We won't be monitoring the questions that come through the chat, so please use the Q&A box. One set of questions, I guess, that's been coming in talks about or asks kind of around the area of preventatives for EPM. I know there's been some things out there about declazaril, I guess, being once a week used as preventatives. What are your thoughts on that and the preventative side?
That's a great question. The short answer is that there are no known preventatives for EPM. The longer answer is that some recent pieces of literature that have focused mainly on diclazaril, or the trade name is Protazil, which is that pelleted product that's one of the FDA approved medications for EPM, has been evaluated in lower doses and less frequent than everyday administration. So essentially taking an EPM medication and seeing if we can give it at lower amounts less frequently, which is obviously more financially feasible. And will that prevent horses from getting EPM? There is no literature yet that will, I don't think there ever will be, frankly, because it's really hard to even induce EPM if you wanted to, which makes it hard to have models for research. So essentially, the research that's been done suggests that levels that can kill the organism on a bench top can be reached in horses at lower doses. So it's very hard for us to kind of take that and translate it to live horses with disease. So with that, there are some folks who have started to administer lower doses in lower frequencies of EPM medications in hopes that it might be preventative. And it might be, but we don't have hard and fast proof of that. So if you are interested in kind of learning more about that, I would recommend talking to your veterinarian, seeing, what they're comfortable doing, what their thoughts are. But at this point, we don't know for certain that there's a protocol that's going to prevent EPM in the future.
Awesome. Good answer. The next kind of set of questions revolves around vitamin E. So, kind of one half of the question is about horses that are unable to uptake vitamin E or maybe have a poor absorption of vitamin E. Do they still benefit? And what dose? Would a horse that normally gets about 5,000 IU per day be better off going with 10,000? What are your thoughts kind of around that whole vitamin E thing?
Good question. And I think it kind of plays on something I alluded to, which is that every horse is going to be different. And some horses might be higher metabolizers or might be less able to absorb than their neighbors. And it can be really hard to prove either of those things. But we all know that there are some horses out there that you might start to give 5,000 IUs a day, which is often a starting point, and you don't see their numbers go up in their blood. And to those, I recommend discussing with your vet. Obviously, your vet is going to be your best resource for this, but in cases that we've had where we have really stubborn vitamin E's, we will look at the product that's being used. So for example, some of the liquid products like Elevate Liquid or Nano E Liquid seem to maybe be better absorbed in some horses. So when we have stubborn horses that are on powder, we might switch them to one of the liquid supplements and then see if that helps them. We might increase supplementation, as the person who asked the question alluded. Sometimes we'll go from 5,000 to 7,500 or to 10,000. It's a generally safe thing, vitamin E. It doesn't tend to reach toxic levels, but never say never. Dr. Carrie Finno is doing some research into possible complications with high dose administration. So with that in mind, talk to your vet. You can increase the amount you're giving. You can change the products that you're using. And then sometimes we'll also combine products. So we'll use vitamin E with another antioxidant. So, for example, coenzyme Q10, which is another part of that. If you remember mitochondria being the powerhouse of the cell and electron transport chain and all that stuff, coenzyme Q10 is another antioxidant, and they can maybe act in concert essentially. And so we'll sometimes add coenzyme Q10 to those stubborn vitamin E horses to see if we can get their levels up that way. But lots of different things.
Sounds good. So only time for kind of one more group of questions. I'm trying to group some of them together. And these are all on behavioral responses. So what about rearing? Is that ever seen as a behavioral issue, specifically with EDM, but all additional behavioral responses?
Sorry about that, Carrie. I heard the first part of the question and then it froze briefly. I heard, is rearing part of something that we see with EDM? And then what was the second part?
More on the other behavioral responses. Depression, going off feed, are these also associated with some of these diseases?
Great question. We see so many different things, and we would never have time for me to go through all of them. But essentially, the abnormalities can range from really hyperexcitable, whether that's rearing, bucking, bolting, either in hand or under saddle. We've certainly seen that gamut. And then all the way on the other side of the spectrum, horses that are quiet, horses that are dull. We don't usually see them go off feed. Generally, we think of more systemic disease or disease of another body system with that clinical sign, but never say never, I would say. But generally, we can see any sort of behavioral manifestation. It's been really interesting. My mentor, Dr. Johnson, will say that when she first started becoming acquainted with this disease, horse owners would tell her, my horse doesn't recognize me, which sounds like such a almost, I don't want to say silly and offhanded, but it sounds so specific. But I swear if we had $1 for every time we heard that, for some of these horses that go on to be diagnosed, we'd have quite a few dollars. So things like, he doesn't recognize me, he flipped a switch, like the frequency with which we hear some of those accounts is really startling.
Interesting. Well, I know you have about another 50 or so questions. If you don't mind hanging out for a little bit and taking a look at some that we didn't get to hear live, I would greatly appreciate it. But with that being said, let's all give Dr. Colmer a round of applause. I thought that was a fantastic talk. Thank you so much.
Thank you for having me. I really enjoyed it. And thank you all so much for your attention. And I look forward to answering your questions.
Awesome. So then I'll ask you to stop sharing your screen. And while I go ahead and introduce our next speaker, she can go ahead and get her slides all shared. So we have another University of Pennsylvania faculty member. So Dr. Bernadette Smith is joining us today. She completed a master's degree at Colorado State University before attending vet school at CSU. She completed internships at Rood and Riddle Equine Hospital and at Cornell Ruffian before entering private practice with equine veterinary care in Maryland. She's an accredited FEI veterinarian with extensive experience in the thoroughbred industry, a particular focus on sports medicine, performance, and lameness. So, Dr. Smith is going to talk to us today about managing the neurologic horse on the farm. So, taking it in a little bit of a different direction. So, thank you, Dr. Smith. I am going to stop talking and turn it over to you.
Perfect. Thank you. It exited out on me real quick, so let me get back. Can
No,
everybody
okay.
hear
I was
me?
just going to say, I'm like, oop, your slides disappeared.
Yeah.
But
Can everyone hear me all right? I hope. Let's see. All right. So first off, thank you for having me here this evening. This is a wonderful escape from the awful winter weather that we've been having out there this past 2 weeks. We live on a small farm, so I've been right there in it with you guys, experiencing the joys of winter and horse ownership. And thank you very much to Rutgers for having me here this evening to talk about this topic. My goal for you tonight is to hopefully enable you to feel more confident dealing with neurologic horses on the farm, so that if you ever encounter a situation like this with your personal horse or horses that you manage, you have some tips and tricks that you can do to help make the situation a little bit less stressful. So I grew up on the Eastern Shore in Maryland. I was very active in 4-H and FFA, so I love it that there's some 4-H alums on here with us this evening. I went to a small school in Chestertown, Maryland, kind of in the middle of a cornfield. And at that time, I was a business and biology major, and I actually ended up working for a bank for a little bit before I pursued vet school, and decided that that wasn't quite filling my cup. So then ended up doing a master's at Colorado State, as you guys were told earlier, and then ended up actually teching at Colorado State. So I was a vet tech for quite a while at the teaching hospital and also for some private practices, and then pursued veterinary school after that. We moved to Maryland in 2018, and we bought a small farm after that, and we had our first baby in 2020, and second child in 2023, and we live on a small farm with our 2 horses, some goats, some ducks, and quite the menagerie. So that's a little bit about my background. So this evening, the agenda for tonight is I'm going to talk a little bit about prevention strategies that hopefully you can employ to prevent neurologic disease from happening to your horses. Then we'll discuss some ways to triage the neurologic disease. So if you happen to, God forbid, have a horse that becomes neurologic with you on the farm, some tips and tricks that you can use to help decrease the stress in these situations. And then I'll give you some resources for additional training that you can use as well to be better prepared. So the first thing that I want to touch on, and I think probably one of the biggest avenues to help you be prepared, is to form a relationship with the veterinarian. And that does start with your annual exam. So I know that this may seem like a bit of a formality, but it is very important that you establish a relationship with your vet and that you're able to determine what is normal for your horse, right? I'll tell the vet students this, when we're learning to do TPRs and physicals on a horse, that you really had to determine first what's normal, and then those abnormal cases will stick with you, and you'll be like, oh, I know something's weird and I know something's off, but not until you know what's normal can you really determine what's abnormal. So not only will your veterinarian do the physical exam on your horse, but I would also employ you to be comfortable doing your own TPR. So if you don't have this in your barn already, this is a nice little cheat sheet that you can print out and put in your barn. And this can be for anybody, right? You can teach your pony clubbers to do this. You can teach your barn managers to do this. And this can just help you know what is normal for your animal, so that if they're ever in a stressful situation, you know that this is actually a concern. And the reason this is relevant in this talk is because sometimes the first sign that a horse has an infectious disease that could become neurologic can be a fever. So it's important to know what's the normal temperature for your animal. And I also want to note that I think it's important to know what's normal in the morning and what's normal in the evening. And I say that because some horses will run a little bit lower in the morning, and some of them will be a little bit higher in the evening. And I found that clinically, oftentimes if a horse is going to spike a fever, I'll usually see it sometime around 3 to 5 p.m. And that's when I, might often tell owners, well, if they checked the temp at the morning feed and the horse doesn't seem right, I may suggest that they go back and check it again in the evening to see if it has spiked a fever. And it's also just important to know what's normal for your horse, right? Some horses may run low naturally at 99.1, while others, their normal may be more like 100 to 103. So for the horse, it may run a little bit lower. A fever for them could be 101, right? Instead of the 101.5. The other thing too would be listening to their heart. So it's rare, right, to have an acute cardiac event, but sometimes horses can collapse from cardiac events, and that can be from things like arrhythmias or things like heart murmurs. We know that neurologic disease can also look like acute collapse and can be, horses falling down or showing signs of weakness. So it's just important to know what their normal heart is, so that if, God forbid, you're in an emergency situation and we find your horse with abnormalities, we know what their heart usually sounds like, and that can help us get to the root of the problem sooner. Other things to be considered consider would be if there's any added wounds or any weird, weird things that are added to your horse that you really wouldn't typically see. So one of the things that you may find is that horses sometimes with EPM, they may be getting like repeat abscesses or abrasions on their hind heels, which is not very common. Like we'll commonly see horses in the fore end that will get abrasions on the front, on the forelimbs, on their heel bulbs from overstepping. But sometimes horses that have some neurologic dysfunction, they'll get heel bulb lacerations in the hind because they're almost like sitting back a little bit. You may see that. So that's something your veterinarian may help you identify on a physical exam. The other thing that's depicted in this picture here, if you see these little spots here, so sometimes horses, I may have an owner call and say that, oh, my horse had a seizure. And that would look like a horse that, all of a sudden, if they may have a video camera on it at nighttime and it was standing there and then it just collapsed and just buckled and went down to the ground. And that can look really scary and it can look like a neurologic problem. And maybe it's a seizure, but sometimes it can be sleep deprivation. And sleep deprivation usually happens because a horse is painful typically and they don't want to lay down. And one of the first signs that you can see is that they'll get these little rubs on their fetlock. And that's because when they go to lay down, because of pain or whatever that may be, they kind of buckle a little bit and they slam their fetlock. So that's something that you can pick up on. The other important part of this is as Dr. Colmer alluded to, is the soundness exam, right? So when I worked on the track, we often saw these horses sometimes every week to every month. And I recognize that is not feasible for most, situations with horses. But I will say, if you're able to jog your horse up with your veterinarian, or even better yet, if you can just jog your horse up, every month or every 6 months and just look for those tiny little changes in gait abnormalities, and looking at their muscle symmetry, if you just make note of that to see if there's something mild that you may be able to catch sooner, I think those things can really help to be able to pick up on something that may turn into a problem later on. And now, with the use of AI, we have these really cool tools. There's one called SLAPE, which is this picture here in a phone, which enables us to get objective measurements of lameness. So there's been many cases where, I don't know, is this lameness or is this neurologic? And I may use the SLAPE recorder to see if I've followed that horse for a couple months. I may put that back on them. And if it's saying that they look about the same lameness wise, then I may go, I wonder if I should do a neurologic exam on this horse. So an example of one that I had a mare that was presenting with some changes behavioral wise. She was just a little bit more grumpy, going one direction versus the other, wasn't holding her canter, and we jogged her up. She was pretty sound when we jogged her up. But then I was like, well, let's go ahead and just do a quick neuro on her and just see what she looks like. And she did have some pretty profound abnormalities on neuro exam. And we ended up taking radiographs of her. And she did have some changes in her neck. So similar to what Dr. Colmer presented, she had some osteoarthritis in her neck. And then the other thing to consider, right, is just doing some baseline blood work and imaging. Sometimes, if you have the benefit of having a pre-purchase done, then you may have, baseline neck films or baseline back films. And those can be really nice to have because if something changes that may cause a neurologic problem, we can compare that to previous films to be able to get an idea. And then also just some baseline blood work, right? If I'm trying to think about if I feel like the horse is neurologic, is this maybe EPM? And maybe we pulled the EPM blood and it was negative, then that's off my differential list. But let's say a year or two goes by, the horse moves to Maryland from California, starts to show some signs again, and we pull blood again, and there is a positive titer. And then if we're able to do a CSF eptop, but that kind of gives you an idea of the thinking where some baseline exams and baseline blood work can help. Secondly, having ER assistance. So, I think we all are very aware of the shortage of equine veterinarians. And as many of you have probably felt, a lot of them will not come out unless you are an established client. So I think that you guys have probably felt this, and this probably occurred to friends where you need to be a client before a vet will come out to you. And there's many reasons for that, but I think it also helps you in these stressful situations to feel prepared. And you'll be able to get a hold of a vet. They'll probably be able to get out to you within an hour, maybe two. But more importantly, they can talk you through what we need to do and hopefully help you come up with some plans moving forward. The other nice thing is, if you have a vet that you'd work with and trust, they can help you make an emergency kit. And I have that in a later slide that you can have in your barn with things to be prepared to help your horse. And then lastly, vaccines. So this is a huge prevention strategy to try and limit neurologic disease, especially the infectious ones, for your horse. So no vaccine or any vaccine is better than no vaccine, right? So I know that some people go to Tractor Supply and get vaccines, and some coverage is better than no coverage. I will say there are benefits to having your veterinarian give it. One of them being is that a lot of the large companies, if it's given by a veterinarian, they will, and the horse happens to contract the infectious disease that the vaccine was meant to protect, they may and oftentimes will help cover costs of treatment, which is lovely because sometimes it can be very expensive if a horse comes down with one of these conditions to treat them. And the other part of it is that if it's given by a veterinarian, we have a medical record of it, and we know when it was given, and that can also help when you're in a stressful situation and you need to figure out, is this possible neurologic problem related to an infectious disease or not. So vaccines could be a whole presentation in itself, but I do want to touch base on it because I do think it's very important, and it's an easy prevention strategy that you can use to help protect your farm and your horses. So vaccines are looped into two different categories. They're either going to be core or they're going to be risk-based. So core vaccines are going to be those vaccines that regardless of what the horse does. So regardless of if, they leave the farm or not, these are going to be diseases that we just simply can't control for, right? They're in our environment and they're here. So that's going to be your rabies and EWT, West Nile. Okay. Now your risk-based vaccines are going to be ones that we can control for a little bit, right? And that's all depends on the area that you live in. And this is something also where having a relationship with your veterinarian, you can come up with a plan for your horse based on what they do, whether you need to do these certain vaccines or not. For our practice, we routinely would consider rabies, EWT, West Nile definitely a core vaccine, but we also consider botulism and rhino a core vaccine, and then influenza and potomac we usually recommend as well. So why does this matter for this lecture? Well, all of these top four, rabies, EWT, West Nile, and botulism, they cause neurologic disease, okay? Even more reason why the vaccines matter is these diseases that also cause neurologic disease, they're unfortunately highly fatal. So for rabies, if a horse contracts rabies, it's 100% fatal. And for the other ones, you can see it's anywhere from, a 33 to 75, 90% fatality rate. And the vaccines are pretty darn effective. So that's another reason why these kind of things do tend to matter for your horse and the whole horse care. And then even past that is a lot of these diseases are zoonotic, which means that we can get them, which is scary, right? I have two kids and they oftentimes are barefoot and sometimes naked out in the barn, and they come with me sometimes on farm calls. So I do think it's important, that we try and protect our animals and also protect our families and protect our herd mates from things that can cause neurologic disease, but really anything in general that we can, if we can protect them and prevent things from happening, then in my opinion, we should. So let me see if this will... Oh, it's now stuck on this slide. There we go. So I'm going to try and drive this point home with a little bit of a case that really drives home the complexity of diagnosing neurologic disease on the farm in an unvaccinated animal. So this particular case, this was Beauty. She was an 8-year-old Dutch harness horse. She was just sold, so there was quite a bit of monetary incentive here. She had history of 12 hours of just not being right. I don't know if you all have heard the term ADR, but it is a medical term that we use, and it's ain't doing right. So she just wasn't well. Her physical exam was within normal limits. She did not have a fever, and her mentation seemed normal. So she was aware of where I was. She was aware of her settings, but she was mildly ataxic, and she did have some weak tail tone. Even better yet, she was right across the street from me. So this is our farm, and this is the farm where little Beauty lived. We didn't share a fence line, but but it was enough to make me go, oh dear, like if this is something neurologic and infectious that I have to worry about, that scares me a little bit. And also, she had come into contact with multiple people. So the owner had obviously been touching her, and his kids were around touching her, and this mare had no vaccine history. So we went ahead and we started supportive therapies. This is, I won't read this, but this is just typically what I do when I get to a farm with an unknown possible neurologic case. Usually end up running them some anti-inflammatories, some IV fluid just to help with hydration. In this particular mare, they did want to be nasogastric tube with charcoal, which I typically wouldn't do, but the Amish, that's something that they like to do. And then we did pull some baseline blood, and it was pretty unremarkable. Came back and rechecked her a little bit later. And at this point in time, she had progressed and she was dog sitting, meaning like just sitting there like a dog, which horses usually won't do. She was able to get up, but it did take some effort. So this bottom part we'll talk about a little bit later, but we did elect to try to run her botulism antitoxin because I was thinking that could have been a problem. So we did that in her treatment, and we'll discuss that in a second, how that plays in. So when I went to Beauty, all of these different differentials came to mind, right? Because unfortunately, she wasn't vaccinated. So it added quite a bit to my differential list of what could be causing these neurologic diseases on the farm. Trauma was very low because I'd asked, if there was any history of her getting kicked by a pasture maid, or if she had gotten stuck in a fence and maybe wrenched her neck. No signs of that. EPM didn't really make sense because it was a little bit too acute for that. Sometimes if a horse ties up and, they come back from a work, they can be really sore and they could present like a little stiff and neurologic, but that didn't seem right. And then obviously colic, sometimes colic, the horses can look dull and not quite right, but it wasn't quite looking like that either. So given that she wasn't vaccinated, these infectious diseases came to the top of my differential list. The first one being rabies, which rabies can be the great pretender, right? The rabies can look like a lot of different things. It can look like colic. It can look like aggression. And we've already learned that there's other things that can look like aggression. So that's kind of scary when you think about, the clinical signs, that they're not very specific. Then I started thinking, okay, well, rabies, I guess it could be, but there's no signs of a bite wound. There's no evidence of a rabid animal around, so not so sure. Then I started thinking, could it be an encephalitis? It was in the summertime, so it was possible, but she didn't have a fever, so that didn't quite add up. And she wasn't having any tremor. She was more just weak than anything. And then I was thinking, okay, well, this could very well be botulism because she did have some signs of some weak tongue tone. So that was pretty high on the list of possibilities. The other thing that I was thinking about was good old EHV1. So I'm not going to talk about this too much, but I do think it's important to note, especially in the light of what, our country just went through with the herpes outbreak. And that was a list. It was on my list of differentials because this mare hadn't left the farm herself. She was being trained at the farm, but the neighbor did just have church recently. So a lot of horses had come into his farm and were there commingling. And those horses also had unknown vaccine status. She also usually with EHV, one of the first signs that you'll see is a fever. So this mare did not have a fever and she didn't have any urine dribbling. So that made it lower on the list, but still a possibility. So this was Beauty later that evening after presentation. So you can see here, I hope these videos coming through okay. They are.
Sorry, yes, so, they're coming through. They're just a little bit slow and choppy, but okay. Again, better than having the gray slide or the gray.
Perfect. So awesome. So she still has some tongue tone here, but by this point, she was no longer able to get up. She was down, could not rise, and I could not even get her to lift her head up, which, when I had seen her earlier in the day, she was at least dog sitting and she could rise. So here I'm just trying to show a little bit of the decreased tongue tone. And then later in the video, let's see. So this is her tail tone, right? So if you think about when you take your temperature on a horse, they don't really want you back there. They're kind of like, oof, get away. And they usually won't let you manipulate their tail like that. But you can see in this video how easy it is for me to move her tail and manipulate her tail around. I mean, I can do it with very, very little effort. So that made botulism quite a bit higher on the list for this mare. We had offered referral, and I had recommended referral before she went down, because unfortunately with a lot of these diseases, once the horse goes down, the prognosis does decrease quite a bit. Referral, unfortunately, wasn't an option. And he ended up having one other horse that presented with similar clinical signs, and we determined that it was likely botulism. So this is another case example of, again, an Amish farm with multiple horses. This particular gelding presented just similar to Beauty, not quite right earlier in the day after the horse had been out on the road. And this horse does have pretty noticeable decreased tongue tone. I apologize for the poor lighting in the video, but for those of you that want to become a veterinarian, this is the reality of emergency calls in the field. We're often working with a headlamp. And, if I swivel over to my truck with a light in the back of the truck to try and get things done. But he was able to get up. But again, it was pretty challenging for this guy to get up with some coaxing. But this was him, unfortunately, about 12 hours later. So you can see in this video that he's really, really, really struggling. And you can hear that he's breathing quite heavy. And that's because with botulism, which we presume it wasn't him, it starts to affect their diaphragm and their ability to breathe. And then they will have trouble taking in breaths. And he has very little tongue tone left. And at this point, it was recommended for human euthanasia. So with this horse, the presenting complaint was that he would just stand at the water trough and wouldn't be able to drink. That was what the owner had noticed on him, is that he was having trouble drinking. And similar to Beauty, this farm ended up losing 5 horses because we believe what had happened is that the horses had been locked in the barn for the winter, and the barn wasn't very well cleaned. So we think that maybe they got into some bad hay and it had become moldy potentially, and the botulism spores had grown there. And that's maybe why it happened. We're not 100% sure, but he did lose quite a few animals to this case. Okay. So just another example of some cases in unvaccinated horses. So this particular case series, this was a horse named Donald. So this was another Amish horse. So he had presented after working out in the fields, had come back in from field work and was, again, just not right. And you can see here that he does appear to be a little bit ataxic and not, fully aware where his feet are and just heavy in his stance, not normal mentation either. Another thing to note on him is that he does have a little bit of sunburn, and that will come into play later on. But he knows that we're there as of that point, but his gait was definitely not normal. So then this was him later. This was a couple hours later. And by this point, and I should have had gloves on, I apologize for that. He does not know that I am there. Like, nobody is home. And he was blind by this point in time. So he eventually ended up going down and we euthanized him. But then, unfortunately, another horse at this farm presented the same way 48 hours later. So this was Dasher, his herd mate, and this horse had progressed quite a bit faster. He ended up being down, unable to rise, and already by the time I had gotten to him, he was seizuring. So these videos are a little disturbing, and I apologize, but this is him in the field. We did, with this case with Donald, we had elected to refer him for necropsy, or not refer him, but we sent him for necropsy because at this point, I wasn't sure, is this rabies? Is this encephalitis? What is this? Because there was no vaccine history on these animals. Botulism was lower on the list because it usually doesn't present this way, but all the other infectious diseases were possible. By the time Dasher had gone down, we had gotten the rabies testing back that it wasn't that, but we weren't really sure yet what the causes were. So you can see here in this video that he's got what's called nystagmus. So you can see how his eye is kind of like clocking in there, and that's an abnormal neurologic finding as well. So for what we decided to do with Dasher is we did refer him to the hospital, and because my thought at that point was, this is now the second horse that has gone down. If we want to get some answers, maybe they can help us figure out what this is. So he was anesthetized, put onto a down horse glide, and we got him in the trailer and sent him there. And it actually ended up being equine parvovirus, which I did not have on my bingo card, and have not seen a case like that since. But I think, these cases just drive home the part where if they had been vaccinated, then I maybe could have gotten to some of these other differentials sooner and put those further down my list of what could be wrong. Okay, so as you can tell, with a lot of these diseases, and even some of the ones that Dr. Colmer discussed earlier, the clinical signs are not very straightforward. So it can be really hard to try and determine what are we dealing with. And if they're unvaccinated, it adds some other things to the list. So for hypersensitivity, right, that can be a sign that we can see in some horses that they start to become just a little sensitive and grouchy sometimes. I've had some Lyme cases that have looked like that, but we learned that EDM can also look like that. And oh, by the way, rabies can look like that. So this is definitely not to say that, if your horse is hypersensitive, that they're rabid, but I think it just drives home the point that if you can vaccinate and get some of those things off the list, then it can help us focus on some others. History of poor performance or some behavior problems, right? I think back to that mare that I had that was showing some, just abnormal signs of lameness that weren't really presenting as a true lameness. And we ended up finding some arthritis, but sometimes, as we know, right, horses with gastric ulcers, they can also have history of poor performance and some behavior changes. So it can also look like that. So that can be challenging and add some things. And then lameness or muscle atrophy, right? We can have horses that can have, low-grade lameness that, as Dr. Colmer alluded to as well, it can be because of a cervical lesion, or it could be, chronic pain. So I think that's where getting a baseline exam with your horse and working with your veterinarian to try and determine from a team approach, picking up on these little things that can maybe help us do a little bit of the homework and figure out what could this be versus what couldn't it be? Because there's so many things that can look very similar and can make some of these things challenging. And I do think it can be a stepwise process. So be patient with your veterinarian when they're working some of these cases up, because you do sometimes have to eliminate some things to get to something that may be a little bit more of a zebra. But I think being able to take that stepwise approach can hopefully help you get the answers that you're looking for. I think something also important to note, and especially with more acute cases of neurologic dysfunction in the field, like the ones I depicted, or just with horses going down in the field, sometimes it can take a while to get the test results back. So for instance, pulling a titer or, doing a PCR for some of the encephalitises, I oftentimes don't get the results back for those for a couple days. And we can't really wait for that to start treatment. So oftentimes treatment is supportive care, right? Where we're trying to just get the horse stable and help it. And there's going to be a slide on that a little bit later. But sometimes that may be in the form of some anti-inflammatories just to try and help get some inflammation quieted down. Sometimes we will do the vitamin E, and we'll do, I'll usually start at the 10,000 international units once a day. And referral, right? Referral is such an amazing resource where we have people in the hospitals, especially in the Northeast area. We're really fortunate that we can send you to help us try and figure this out and, dig in there deep and see if we can find any differences that could be causing these problems. So because all of these things do look so similar, one of the important things I also want to drive home is the importance of biosecurity. So, I feel like sometimes people will think that it's overkill and it's a pain in the butt. And I know it's a pain in the butt because I've been there, I've had to do it. But what if it means you can save some lives, right? I would much rather, if you have a horse that you think has a fever and maybe is having some neurologic signs, or even if it's just, some acute neurologic signs without a fever, I would caution just to start instituting some basic biosecurity protocols. So every farm should have gloves at the farm. That's one of the very simple things that you can do. And it's a really easy task that you can institute to try and protect your horses and also protect other horses that may be a little bit immunocompromised. I recognize that sometimes when we do this and it causes hysteria, and that's definitely not what I want to do or not what any of us want to have happen when we do some of these biosecurity practices and we ask barns to do this. But it's one of those where I would have rather have done it and not had it be an infectious disease versus not done it. And then we're playing catch up on all these cases. So if you're a numbers person, this is a slide that I hope will kind of drive home, the ratio, the benefit of doing vaccines. So vaccines, these prices may change a little bit, but I think all in all, the cost of the vaccine is going to be substantially less than the cost of treatment for some of these ones that we could have prevented with a vaccine from happening. So just something to think about when you're trying to decide, what do I need to do to keep my horse whole and preventing some of this from happening? This is something to consider. I oftentimes will have clients say to me, this is never going to happen to me. This is only stuff that you hear about in the storybooks or on social media. Well, as we know, just recently, I think this outbreak that we just had happen, I don't think anybody thought this was going to happen to them with the herpes case. And even more so this one with a horse that attended a horse show and was positive for rabies, right? So this is a horse that is probably looked at by multiple veterinarians, has been exposed to many people, has traveled many places, and it ended up being rabid, which gives me chills just talking about it. This is what my face looks like when I think about this. So I think it just drives home the importance that we pray that this will never happen, and we hope that no one ever has to deal with this. But the reality is it does. And we can only do what we can do, right? You can only prevent what you can prevent. But if you can do simple things to try and eliminate problems like this in the future, then why not, right? Why not do what we can to protect our horses and protect our community? Okay, so now we're to the point where we're going to try and help you deal with a horse that may become neurologic at your farm. So let's say you walk out one morning and, Fluffy is just a little bit slower, and then you see Fluffy go down. What are you going to do? Okay. So I made this little flow chart for you to try and help you determine the next best steps for how to work through a horse that may have gone down. So the first thing that I would say is before you go into the stall, look for an exit plan. Okay. I say that because horses are prey animals. They do not want to be down for a long time, right? Their inner goal is going to be to get out. So if they're down, they really don't want to be down. Sometimes horses are like, okay, this is inconvenient. I'm just going to lay here and let my loved humans come help me. But sometimes they panic. So before you walk into a stall, just look around and see, how can I get out? And if I'm going to go in and help this animal, do I have an easy way to exit? Because we don't want you to become a part of the rescue. I don't do humans. And I would prefer to not have to treat people. I don't know how to treat people, but just something to think about, to take a couple seconds to look at your scene, see if you need to get water buckets out of the way. What can I do to try and help alleviate any issues? Next, I'm going to say take a temp if you can, right? So let's say your horse isn't down and they're just a little bit neurologic and acting a little bit drunk. Okay. Put some gloves on and then take a temperature. Then you're going to want to call your veterinarian. So your veterinarian is probably going to ask you, this is one of the first things I ask my clients is, what's the horse's temp? I won't say, does he have a temp? Because oftentimes clients will go, well, he doesn't feel hot. So if you can, try and take a temperature and figure out what the temp is, because that may help us determine where we want to go with this. The other things that you might want to note is, does your horse seem distressed? So is he panicking? Are his eyes bulging? Does he have a nostril flare? Does he seem really worked up? Or is he just kind of like chilling, like, okay, well, this is not good. We need to get out of this situation. And then also, how long has he been down? So if he's been down for a long time, that does matter, because horses that have been down for over 24 hours, it does decrease the likelihood of survival. So it's an important thing to make note of. And sometimes I know we might not always know that, right? If they go down overnight, you may not always know, but you can look for signs of struggle. So like if the ground around them looks really beat up, or if there's signs of stress, that'd be something you would want to let your veterinarian know. And then also, is the horse responsive? So a simple way to do that is to just talk, right? Just talk to your horse, call their name. If you have a treat that they like, you may shake the treat bucket and just see if they respond. So those are all things you may want to take note of. Then we may ask you to give some anti-inflammatories. Okay. The reason that I do this is because oftentimes on emergency, like a lot of us, we're the primary doctor on call for most times, and we may be dealing with some other emergency cases. So If I have a client that we've done an ER kit, I know that they have Banamine, I may go ahead and ask them to go ahead and give some Banamine orally to give a dose that would be, correct for that horse. And that can hopefully start to help with some pain, because sometimes horses go down because they have arthritis, or they laid on a bad side that they may have history of. And sometimes the Banamine, if we can get that on board by the time the vet gets to you, it can help hopefully the situation go a little bit better. And then next, it would be to see if you can mobilize the animal and potentially get it up. So I'm going to show you a video in a little bit on how to get a horse up and what that looks like. But if you notice that your horse is not walking normal, you just want to move it, it's best to have another person there with you. And what I would recommend is that one person holds the horse from the front and you kind of stabilize it with your hands. So putting your hands on their halter, and then you have another person that stands behind on the tail. Okay. So this picture doesn't quite show the head hold, but sometimes it's kind of like if you wake a horse up from anesthesia, if you've ever seen a horse be castrated, and then we go to stand it up, and we'll kind of let them get their sea legs back, and we'll kind of stabilize them as they're trying to get their sea legs back. That's how I would recommend walking a horse if you're trying to get them away from a fence or away from a car or whatever it might be to try and help them. Okay. And then I think it's just important to note the time. So that matters because, as I alluded to earlier, the horse isn't going to want to be down for very long. And if you have a horse that goes down, for instance, in a stressful event, like at the 5-star, we have horses that go down at the eventing competitions, and it's usually about a 5 to 10 minute window where they'll be down and they'll be shocky. And then they start to realize what's happening and they jump up like a chicken with their head cut off. So it's just important to keep track of time so that you know what you're dealing with. Okay, so other things to think about before you go to assist your horse and get it up. I talked about this a little bit, but I'm going to just discuss it in a little bit more detail. Just step back and take a look at what you have, right? So is your footing slippery? Do you need to put down maybe a little bit of shavings or kitty litter or something? So for instance, in this weather, we've had a lot of horses that have gone down in this weather because of the ice. And sometimes we're just simply not going to be able to get them up because they just can't get their foothold. So we've had to bring in some bags of shavings or whatever it may be, or a mat or something to be able to help this horse get up. Do you have a vehicle that you need to move, or is there a tow truck close by, right? Is there something that you can get out of the way? Because it's also happened where we've had horses that are down and they get up and then they end up in a worse predicament, right? They end up underneath of the tow truck, or they end up caught in a wires, right? So many things that can happen. Whereas if we had just taken a little bit of time to clear the scene and manage the scene before we got the horse up, it would have made it a lot smoother. Or are they in a ditch? So this particular case, this was a case that I helped with. It was a horse that went down on the road right by my house, and it was actually on maternity leave when this happened. And they had called me and they said that they needed me to come and put this horse down to euthanize it because it had been down on the road and they couldn't get it up. So I said, okay, I can come, but someone's got to hold my baby. So I got in the vet truck, went there, called my husband and said, I'm on the way to Warburton to go help this horse. And he goes, oh, I'm on the way too. And I'm like, why are you on the way? He goes, it's all over Facebook. It's all over social media. I was like, okay. So that actually worked out okay because he could hold the baby instead of having somebody on the side of the road hold the baby. But what ended up happening is this horse had gone down because it had heat stroke and it had a bad airway, and it essentially passed out from being too hot. This is in the middle of the summer. And this horse, when I got there, was actually down, stuck in this ditch. So it was kind of like turtled in the ditch. And this is a 1,800-pound draft horse, right? So it was stuck in the ditch like this, and it couldn't get its legs underneath of it to get itself up. And they had been working on this horse for over an hour to try and get it up. When I got to the scene, they had 2 tow trucks, they had 2 tractors, and I think every neighbor in the Cecil County area was there. So what we ended up doing was just sedating this horse, pulling him so that he was actually upright in the ditch instead of turtled with his legs up in the air. And then we stabilized him, ran some cold water over him, and we actually got him up. So I didn't need the tow trucks. I didn't need the tow straps for him. I didn't need the tractors on this case. This horse just needed a little bit of a step back and to take a little bit of time to figure out, okay, what do we need to do to set us up for success so we can get this guy up? I think the other thing to note, I saw on here that there's going to be some people with rescue situations that, may have some horses go down in with a big crowd or, at events and things like that. So this video, I don't know if you guys have seen this, but it's a little scary. I'll just mute this. So you can only control what you can control, right? So we can't control that there's 10,000 people in the stands. We can't control that. But this team, this is a Budweiser draft horse team. They worked a lot with their horses to trust their humans. And I think that's why this outcome was so incredible for these animals. So you'll see it happen here in just a couple of seconds. And it's quite scary. And there's thousands of people around that you can't really control that, but a horse essentially ends up going down and getting stuck underneath of its teammates. And now there is tack and other 1,800-pound animals and hitches and all kinds of things that are preventing this horse from getting up. So I think the point of this is that if you're ever in a situation like this, if you're an innocent bystander and you walk up to a situation where there's a lot of things around, maybe send somebody away to go, like if it's a, let's say, car wreck and a horse is down, right? Send someone, delegate jobs to get them out of the scene, decrease the sound, decrease the chaos. For Barney, actually, this horse over here, he had on a halt or a harness for driving, and the harness kept slipping off. So I couldn't really use the harness. So I ended up sending somebody to go get me an actual halter. But funny enough, it was one of the Amish gentlemen who went to get the halter and he left on his scooter. So it took a while to get the halter. So I did delegate and I did get people moving so that they weren't at the scene. But I think just important things to think about, right, is that if you're able to control the scene and you're able to decrease as much chaos as you can, that can really help manage these kind of situations. And that's delegating people to go get something, removing people from the scene, removing tack. They eventually do end up getting this horse up. But this video, if you just Google Budweiser wagon accident, you can see that they're able to get the horse unhitched. And then later on, he does stand. So I think right about here, they are able to get him up. So this was a very happy outcome. Thank God. This could have been quite awful for this animal, but he trusted his owners, trusted his handlers, and he was able to stand. So let's see. There he goes. So yay, thank goodness. And that happened in front of a ton of people and they handled it with pure professionalism. Okay, so let me move on. Okay, so this video here that I'm going to show. So let's say you are in a situation where your personal horse is cast, okay? This is a quick tutorial on what you can do by yourself. If you're able to have one other person, that will make this even easier for you, but to unroll your horse and get it unstuck. So this video can be applied not only if a horse is cast up against a wall, like it's depicted here, but also if you have a horse that's down in a field, right? Sometimes horses will go down, like we talked about earlier, if they got a vaccine and they're a little sore on one side of their neck, they may go down because they just can't use that side of their neck to get themselves up. So all that you have to do is just flip them, give them a minute, and then they pop up. And they're like, okay, that was pretty uneventful. So I'm just going to go ahead and play this video for you. This is done by an amazing group called the TLAER, and they do a lot of training for first responders. And we'll talk about that a little bit later, but it does walk through some good precautions and things to take. So I'll just walk you through what they're talking about. So first, they're going to gain head control, which again, if you have another person to assist, this is very helpful to have the head control. That way you can protect their eyes and make sure that their head doesn't get bumped. And then what you'll see here is that they're going to actually put on a little head bumper to try and protect the horse's eyes. For this particular example, they do have a veterinarian on the scene to help stabilize the animal. And he makes a little, like he's doing a little play, like, this horse is stuck, please help. It's a pretty cute video. So then what they're going to do is they're going to bring in a team to help get the down. Oh, sorry. This is when they put the head bumper on. So you can see, you can just just use a basic life jacket, but if you don't have a life jacket, oftentimes even just putting a towel on your horse's eyes just to protect their down eye from getting an abrasion on it while you're trying to manipulate them. And if they're panicky, right, they're going to bump their head quite a bit, and just putting a towel over them if you don't have something like this can also help. So then what you're going to see here is that they're going to come in with a wide toe strap. So I said no tow trucks, right? Because we really don't need tow trucks, but these big straps can be very helpful. And oftentimes people that live on a farm, they'll have some of these hanging around. I've also just used lead ropes. So if I don't have the tow straps, or if the farm doesn't have tow straps, I just take a lead rope and I make that loop, and you loop it around the down leg. So that's the important part of this, is that it has to be the down leg, right? Otherwise, you're not going to be able to flip the horse, and you're just going to make them do the splits, okay? In this particular video, they only demonstrate doing the hind limb, which is a really good demonstration. Sometimes I've put it on the hind and the front, depending on how many people I have. And you're going to see they're going to take a little technical time out here to try and help the horse not go all the way over, but because it slides, because it's a mannequin, so they make note of that. But the nice thing about this technique is that you've already established, right, that you can quickly exit. But with the long ropes, once the horse gets up, you know that you're going to be safe, and you're not going to be in the way of them trying to get their feet. So this is something that, I strongly encourage rescues to. You can use this technique, because a lot of the times the rescues, you're going to have horses that are going to go down. Unfortunately, it's just part of the business. They're going to need some assistance. We'll talk about it a little bit later, more training on helping a down horse get up. But this is a really simple technique that you can use to try and get your horse unstuck, hopefully. And it kind of goes into the whole thing of time, right? To be able to not have a horse down any longer than you have to. Okay. So this slide is very busy, and for owners, you don't have to worry about this. But I just put it on here because from the veterinary side, there's a lot of things that may be happening to try and get your horse stabilized, to try and help them get over this hump. So for the vets in the room, this is my typical cheat sheet that I use for a down neurologic horse. I do want to note that oftentimes in these down horse situations, we will sedate the animal. And I know that sometimes makes people nervous, but I think it's important to note that, these horses, they're panicky, and you really can't help them if they're fully awake and thrashing. So that's where the sedation comes into hand, because in order to safely help them and manipulate them and move them, they're going to have to be sedated. And we use it in increments, but I think it's just important that if your veterinarian is there to help you and they go to sedate, just trust the process, and trust that they know what they're doing, and that this is the best way to eventually get your horse up safely, depending on the predicament that they may be in. Oftentimes, they'll pretty much always get an anti-inflammatory. Maybe they'll get some IV fluids. And these are just some other notes on things to, work on depending on the time of year. Once they're up, then sometimes the hardest part is yet to come, right? We have to figure out, why did they go down to begin with? And then do they need to be outside instead of inside? Because we don't want them to go down again. So may it be better for this animal to stay outside for the night so they don't get cast again? Check their eyes to make sure that they don't have any eye trauma from being down. And then these are just some other things that, put into consideration for your differential list of possibilities that may have caused your horse to go down. As we've learned, the list is never ending. There's a lot of reasons why horses can become neurologic, and there's a lot of reasons why they can go down. So this is where, that team approach can really help. So one of the things that, I hope that I've driven home in this lecture is the importance of being prepared. So this is a picture from an equestrian initiative trip to Costa Rica that I went on, where we worked on some working equids that work in Costa Rica. So the horses that help make our coffee and help make our sugar. And this is how they packed the truck. This was some pretty impressive packing. But I think this list here, these are all things that I would recommend that you have at your barn. Pretty much all of us have helmets, and if you don't have a helmet, then I would definitely get one. You should be wearing them for riding, but at the very least, in case you ever have to deal with a situation like this, it's nice to have a helmet for something like that. Also, sometimes a reflective vest, and I say that because horses never go down in convenient places, and they never go down at convenient times, right? They may become neurologic at 2 a.m. and that's just what happens. So having a reflective gear on, if a vet has to get you out in the middle of the field, same thing with a headlight and a battery powered light, that can help us treat the animal. Gloves, we already talked about that, the importance of gloves. I also think it's nice to have a nylon halter and a rope lead. The reason I say that is because similar to Barney, when I sent the people on the scooter to go get my halter, leather can break. And if you're going to be pulling on this horse to try and get him up, you don't really want to go through all that effort and then have the halter break on you. And then you have a loose horse after you've gotten it up. That'd be really unfortunate and sad. And then a rope lead, because I don't really love the idea of chain shanks if you're trying to use that, because same thing, if the horse jumps up and is very excited, the idea of the chain, on their nose and potentially causing further problems. And things you never thought you'd have to have in your tack room, but bolt cutters, just in case, God forbid, your horse gets stuck underneath of a fence with the no climb wire. Bolt cutters are happy or good to have on hand, and alternative footing. So like the shavings that we talked about, in case your horse goes down, and, even sometimes a concrete stall that may be a little slippery from humidity. I know my barn does that. It can be nice to just have some extra footing available that you can help your horse get up. And then also an emergency call list. So a phone a friend, somebody that you can call that can help you in a pinch if you need assistance. So this is the slide that I told you I'd share for the emergency kit that I liked for my clients to have. These things, again, they would usually all be administered under the supervision of a veterinarian. So this is where having a good relationship with your vet and getting these things ahead of time, right? And that means that in order to get these things dispensed to you, your vet has to see you. So you need to have been seen, usually for most practices, within a year. But these are things that, they can just help you be better prepared. And I know sometimes for me, I feel like I just have to do something, right? I know we often feel like we need to help some way. And these are things that will enable you to do that, to try and help your horse and help yourself and help your veterinarian help your horse sooner. I put sedation on the list because I do have some clients that I do dispense sedation to, because we've had some times where if the clients are far away and a vet can't get out to them for a couple hours and the horse is in an unfortunate situation, like for instance, a car wreck, right? Or a trailer accident. I have sent sedation with clients when they go on long journeys, because if God forbid they get in a trailer accident, oftentimes you have to try and sedate these horses to try and help them. And they don't have a veterinary established with where they're going. So it can be nice to have that. But this also, you need to have a good relationship with your veterinarian to be able to have these things and be prepared. So just some things to think about. So this is just a slide on some additional training that is available to the community to learn how to be safe in these kind of situations and not become a part of the rescue. Okay. I know that sounds silly, but these horses are unpredictable and things can change in a blink of an eye. I've been fortunate, unfortunate, not really sure which one, to assist with a lot of rescues. And people have gotten hurt in some of them. And it can be hard, right? Because they're already high stress and they're already very emotional. So I think, the more you know, the more you know. And if you can walk into these things, especially for, people with rescues and the veterinary technicians, I think having these skills is really crucial for your community and for your team to be able to help navigate these tricky situations. So in summary, do the prep work, right? I don't know how much you can prep for riding an ostrich in a race, but hopefully we want your horse to stay up and not down. Okay. So I think the prep work that we talked about, that can be really crucial in setting yourself up for success. And then secondly, I think, the other thing to think about is we all know how intuitive horses are. And I think oftentimes we don't give them enough credit for how much they feed off of our emotions. So do your best to stay calm. This is a picture of my oldest son, and he is just totally vibing. I mean, nothing could upset him. So oftentimes I try and harness my inner child when I walk into a scene and just think, okay, be the cowboy hat, be the sunglasses. I got this, right? And I think it's important to try and walk into a situation like that, because your horses and the other people around you are going to be looking to you for some sense of calmness and control. And then just be as prepared as you can with what you can. This is my son on a hike, and we were not prepared for this hike. As you can tell, he's in his floaty and a diaper and no shoes. So I wouldn't walk into a situation like that. But I think if, in order to stay calm and collected, it will help with you being prepared. And that is everything that I have.
Awesome. Well, thank you, Dr. Smith. I did let you finish up because I knew we had some technical difficulties at the beginning, but thank you very much. That was a fantastic talk. We do have a couple questions, if you don't mind staying a little bit late.
No, not at all.
But before we do, what I want to ask everyone is because I know we've lost a couple people due to time. Kyle, my man behind the curtain, is going to put in the chat box a link. If everybody could take just 3 to 5 minutes and give an evaluation of what you thought about the topics today, speakers today. Oh, I'm sorry. And give us some feedback for what you might want to hear next time. That would be great. I'm also going to post some slides when we're done with questions too, which will have a QR code, but for now we'll just have the link in there. So yeah, the first couple of the sets of questions I have is kind of back to your vaccine slides. So, what are the laws, and do the laws vary by state regarding different vaccines? Because we know there are certain demographics that may or may not vaccinate, but what are the laws? And then also, what are the thoughts on horses that have had EPM getting their vaccines? Because make them relapse. That's kind of the thoughts, and
Sure.
You speak on along those.
Yep. So unfortunately, the laws aren't very clear, and it does depend on what state you live in. So what I would recommend for that is reaching out to your veterinarian to see if there's any vaccines that are required. Most of the time there are not, which still blows my mind that rabies is not required by the entire United States as a core vaccine. But unfortunately, we don't really have those laws that are set forth to all animals must be vaccinated. It is up to the discretion of the client. So nothing there that we can hold anybody to. And that, is oftentimes we have Amish neighbors and I love them dearly, but it's a challenging part, right? Because oftentimes we share borders and we share roads and, we share a lot of things. So it's just something that we just have to be prepared for. And I think that's where the biosecurity and, when you go to horse events, don't share buckets, take your horse's temperature, try to not share grazing areas, like things like that, just to try and keep your horse safe and prevent infectious disease. I think that's the best that you can do, because you never know if someone else is vaccinated, and you never know what their immune system is doing, right? And we know too that the vaccines are pretty effective, but similar to COVID in people, they won't always stop the horse from getting the disease, but they will hopefully stop them from getting as sick. And then even more importantly, decrease the amount of shedding, which is huge when it comes into terms of, the other horse population. So unfortunately, we can't I would assume that the horse is not vaccinated. That would be the best assumption, to keep your horses safe and just follow good biosecurity measures, and just be cautious. And then in regards to the EPM question, that's a great question. And I get that a lot from clients where they'll say, my horse has history of chronic disease and I don't know that I want to vaccinate them because it's caused them to flare in the past. In those cases, then what I'll do is I'll still try and at least do a rabies EWT West Nile, because they are so devastating. They're so devastating when a horse gets it. And it can be, really, really hurtful it's really hard on the owners when that kind of thing happens. So I do try and at least do those. There are ways that if you know that your horse is sensitive to vaccines, that we can preload them with an anti-inflammatory. So if I have a horse that has history of vaccine reactions, I'll oftentimes give Banamine. And if it's a bad reaction, sometimes I'll even give Banamine and dexamethasone, just to try and decrease that reaction that they may have, right? We want the body to have some sort of a reaction to build up an immune response, but sometimes the body goes into overdrive and it's too much. So if we have a horse that's documented to have a reaction to vaccines, then sometimes I'll pre-medicate them with Banamine and dexamethasone to try and prevent that. So that would be something that it's just important to let your veterinarian know that, your horse didn't respond very well to the vaccine last time, and then you can take steps to try and prevent reactions in the future. Yeah, good question.
Great. Good good feedback too. So this is, I guess, kind of along the same lines with horses with EPM or similar diseases. Can they relapse with stress? So, for example, like or sedation with like routine better care, like dentals and stuff. They've been told that oh, you shouldn't do that because your horse might relapse because of the stress or the sedation.
Yeah, I think it's one of those where you have to assess like the risk benefit ratio, right? I can't think of many times in clinical practice where I've had a dental cause a relapse of EPM. Can excessive, like if they're going to repeat horse shows and if there's like a big change in the barn or if they had a recent onset of disease, right? Let's say they had a low grade fever from a viral infection or something like that. Some other kind of stressful event that, yes, I do think can, set off some other things that may be underlying. Like, for instance, we know with herpes in particular, like that can be latent in horses. It's latent. And, the studies have shown that 80 to 90% of horses have been affected with that at some point in their life. And then it can just pop up. And sometimes the pop-up is going to horse shows, right? That can be the stressful event. And unfortunately, we don't always know what is considered a stressful event to your animal, and it can be different for every horse. Some horses, a stressful event is, a donkey showing up to their farm. Because the donkeys smell different and they look different, and that may like set off something. So I think, I wouldn't say in my hands that I've had any like particular medical procedure like a dental cause a flare, but I think that's where it's just super important to have that open conversation with your veterinarian about that concern, and then you can come up with a plan to mitigate those risks.
Good point. So we got one more question, but while you're answering that, let me just ask you to stop sharing your screen. I'm going to pull up mine. Anti-inflammatories like a horse on daily Equiox also be given Banamine if they're in an emergency situation.
Yes, good question. So I will, in an emergency situation, I will oftentimes give more anti-inflammatories. I'll try and just stick to one. So like if I know that a horse is down because they're arthritic and they're already on Equiox, it's obvious that that's probably not doing enough for that animal if that is why they're down. So I won't hesitate to give Banamine, but what I would do is maybe consider running some routine blood work on that animal, like pulling a chemistry to try and look at kidney values to see, is their creatinine a little bit high? And should we maybe run some IV fluids to this guy to try and help him feel a little bit better? So in my hands clinically, I would still give more anti-inflammatories because oftentimes if these, especially down horses, once they've been down, they're going to feel like they got hit by a bus, right, for a couple of days, and they're going to be pretty sore. So I will do initial anti-inflammatories and then maybe, stick with the Equiox long term. But I think that's where doing some serial blood work and following up with some other supportive care can be really helpful. So whether that's gastroprotectants like, Gastrogard or omeprazole, just to try and help their tummy, making sure that they stay hydrated, making sure that they continue to eat and they don't get impacted, like all those good things.
Excellent. Well, thank you again. That's all the questions we have. I want to give a huge round of applause to Dr. Smith. Thank you so much for your time. I did pull up my slides. I want to thank both speakers. So thank you, both Dr. Colmer and Dr. Smith, for your talk. It is very scary stuff. And I saw several comments come through in the questions like, wow, I feel prepared, but yet nonetheless, this is scary. And I totally agree as a horse owner. It is very scary, but thank you very much again. If you've enjoyed the day, please consider donating to the Equine Science Center. And we hope everybody enjoyed everything. I look forward to seeing all of you next Wednesday. And I hope you have a very safe and well rest of your week. Take care.